Prostheses have been used to help amputees walk or use both their hands again since the ancient times. Surgical procedure for amputation was not largely successful until 600 BC, when armorers of the Middle Ages created the first sophisticated prostheses using strong, heavy, inflexible iron in which the amputees could not really control. In 1812, Peter Bailiff developed the limbs below the elbow, and in 1844, Van Petersen developed the limbs above the elbow. They were functional, but still not ideal. In 1909, D.W. Dorrance developed a terminal device to be used in the place of a hand. Until its invention, the prosthetic arm had consisted of a leather socket and a heavy steel frame, and either had a heavy cosmetic hand in a glove, a rudimentary mechanical hand, or a passive hook. Dorrance invented a split hook that was anchored to the opposite shoulder that could be opened with a strap across the back and closed by rubber bands. The prosthetic arm replaces the following bones: phalanges, metacarpals, carpals, ulna, and the radius. It also replaces the following muscles: brachioradialis, extensor carpi radialis longus, flexor carpi ulnaris, extensor carpi ulnaris, and the extensor digitorum. Some even replace up to the humerus, triceps brachii, biceps brachii, and the brachialis. The 20th and the 21st century has seen the greatest advances in prosthetic limbs. Materials such as modern plastics have yielded prosthetic devices that are strong and more lightweight than earlier limbs made of iron and wood. New plastics, better pigments, and more sophisticated procedures are responsible for creating fairly realistic-looking skin. The most exciting development has been the development of myoelectric prosthetic limbs. Myoelectricity involves using electrical signals from the patient's arm muscles to move the limb. In recent years, computers have been used to help fit amputees with prosthetic limbs. When looking to the future, we can soon see mind-controlled artificial arms, also known as bionic arms. Many are actually being tested by amputees right now. Researchers have enabled communication between the prosthetic device and the wearer through a technology known as TMR, which involves taking remaining nerves from the amputated limb and placing them in a pectoral area of the chest where electrode sensors read signals for movement. Doctors move the ends of the nerves that used to connect the mangled arm to the chest. Electrodes on a harness detect tiny electric signals from those nerves and transmit them to a miniature computer. The computer translates them into signals that control small electric motors in their new arm and hand. When they want to pick up an apple from the kitchen table, they think of it, and their arm, hand, and fingers do it. Some complications that may come with a prosthetic arm may be psychological. Others may be physical. Many amputees come across the pain called phantom pain. This is where amputees can still feel the part of the limb they had lost. Other physical complications may be skin problems. Rashes may occur where the prosthetic and the limbs meet. Once the prosthetic limb has been fitted, it is necessary for the patient to become comfortable with the arm and learn to use it in order to meet the challenges of everyday life. At the same time, they must learn special exercises that strengthen the muscles used to move the prosthetic arm. When the patient has been fitted with the myoelectric device, it is sometimes true that the muscles are too weak to effectively signal the device. So again, the muscles are exercised to strengthen them. Some new amputees are trained to wash the devices and to practice getting them on and off. A patient fitted with an artificial arm must learn to use the arm and its locking device as well as the hand. If the amputee lost an arm due to an accident and it is subsequently fitted with a myoelectric device, it is relatively easy. If the loss of the limb is congenital, this is difficult. An instruction system has been developed to teach amputees how to accomplish many small tasks using only one hand. Although I don't think that it can be called cheating, I do think that having prosthetics do give people an unfair advantage, both ways. Prosthetic users may not only have an advantage over able-bodied athletes, but disadvantages as well, thus not being fair for either the prosthetic users or the able-bodied athletes. Yes, it is true that to gain that advantage, they have had to lose a huge part of themselves, literally gaining a disadvantage at the same time. The Cheetah Flex Foot carbon fiber transibital artificial limb is said to use 25% less energy than those of an able-bodied runner moving at the same speed.